Hi, my name is Betty, and thank you so much for joining me today. It's been a while since I've been here, but I've been working on something that is going to be very, very exciting, and I hope that you are going to want to know more about it and come and join and listen in, and then you can move from there. So, for those who know me, hi, thank you for watching me, thank you for subscribing, thank you for clicking that button and not walking away and just being there to support me. If you know other people that can support this mission, send my clips, let the word spread the word. That's what they say, right? So again, those who don't know me, hi, if you're watching me for the first time, my name is Betty and I am a home care provider, but I also do home care consulting. So if you have home care questions, if you have issues with your home care, when it comes to the operations, when it comes to scheduling, whatever it is, when you are still on the idea phase and you want to launch, I'm the person to come to. And also, I can tell you that, it's not an easy journey, but it's a doable journey. That's very important. Okay. So a few weeks ago, we started a series and we started talking about how to start a home care, right? And just, going a little step by step. All right. At the end of this presentation today, I'm going to share with you what's coming on the 1st of May. So be ready, okay? Be ready. So today, as you can see, I'm going to be using slides, and I'm going to be using slides for a while because I want you to be able to just see what I'm seeing. Yeah. Instead of me just reading from a paper, you can see what I'm seeing. So initially, a few weeks ago, we had talked about setting up your home care. We had talked about administrator courses. And so now we are talking about caregivers. Of course, here in the YouTube, you might get strategies here and there. But if you want to speak with me directly, you can always do that on the channel. You have a way to book an appointment with me. Go ahead and complete the form, and then I will have that, and my team will be able to schedule you in. Okay. So if you have a question, if you need to get in touch, just fill in the form. It's the best way to fill in the form and get in the scheduling system so that my team can be able to put you on my calendar. You will speak with me directly, okay? But then my team will do the scheduling for me, okay? So today we are talking about caregivers. And if you are in the home care space right now, you know that this is one of the, it's one of the hardest part of home care. So today we're just going to talk about a few strategies of how to navigate, and just a statistic that I discovered the other day: 79.2% turnover of caregivers in 2024. Can you imagine that? 79.2% of turnover. That is so high, it's ridiculous. Okay. But there are a few things that you can do that can be able to keep your caregivers always expecting from you. Now, those are strategies we talk about, especially if you're in my community. We talk about that a lot. Simple ways, ways that are not expensive for the organization for you to retain, and also have other things to make them retain. Now, it depends how you hired these caregivers, okay, which we'll get to talk about at some point. So, and now, moving on to the next slide. So the high turnover of these caregivers demand has become more critical now, and it has become more critical in this industry because we have a lot of people that would like to receive care, but they're not able to receive care because of there's no staff. Okay, there's no staff, and so that's a very it's a very hard thing too. So hiring, so the caregiver industry faces staggering 79.2% turnover. That is 2024. So you can imagine we're in 2026. We haven't yet seen very clear statistics for last year yet, but it's definitely going to come through. All right. So hiring strategy is no longer just about filling roles, but it's a business for the business to survive. If you are in the home care industry, apart from you having all those policies and procedures, whatever, everything nice, just on book and paper, the people who drive the business are the caregivers. Okay. You're in the home care industry. Caregivers are the ones who support the clients. Okay. You can get 10 clients, but if you have no one to staff those clients to, then you lose those clients to someone else who has the capacity. Okay. So that is one thing. Like, if you want the business to survive, you have to make sure your caregivers are doing good. Okay. So today's focus, we're going to compare hiring models and innovative retention strategies. Okay. So I hope you have your notes with you. That's very important. If you have your notes with you, I am so happy. I hope you have your notes with you. Then at least you can move along with me. So you make strategic choices in hiring models that impact, okay? It can be long-term or short-term stability, okay? But you have to be able to hire correctly. So on demand is per shift. So focuses on workforce flexibility and lower fixed labor cost, ideal for scaling with client demand fluctuations. Now, on demand, if you're in the healthcare industry, on demand means like PRN, okay? PRN. Most of you understand the word PRN. Now, I'm going to talk about the two models. So on demand is, I have a client, I call the caregiver, hey, are you available? I have a client, and the caregiver will take that client if they want to. If they don't, you call the next caregiver. All right. So full-time caregiver, of course, is when the 40 hours come in. That means you're paying the caregivers full-time, right? So whether you have a client or not, you're paying. So the priorities of this one is staff stability, consistent training, and stronger client relationships for higher quality care. Now, and then we have the hybrid approach. You maintain a core full-time team supplemented by on-call caregivers for peak periods. This offers the benefits of models while mitigating the drawbacks. Now, I want to say something. If you are starting your home care business, I don't know what other consultants say. I really don't. Every consultant has their own way they do things. Personally, if I am working with you, if you are starting off your business, you are not going to have full-time caregivers. Why? You have no money coming in unless you have some money somewhere just sitting, just waiting to be used. You have no revenue coming in. So when you have the PRN and which is also on-call caregivers, right? When you have a pool, you keep hiring all the time, you're hiring. So you always have a pool of caregivers, right? And what happens when you work with me, I show you how to set up that pool of caregivers. So whenever you get a client, you don't have to wait until you go to the office. You don't have to wait until you go to the office to be able to communicate with those caregivers. So you have this pool of caregivers. Maybe you have like 10 or 15 caregivers. And what you do is when you get a client, you shoot a message. The message will go to all the caregivers. So that it's first come first serve basis, okay? Unless you have seen something really special and they like with that client, maybe in their care, and you know that there's one particular caregiver who has that experience to handle that, then you can first send them the message directly. If they say no, then you send it to the pool. That makes it very, very easy. Actually, even hospitals do this. When they have their PRN team, their float team, they have a database where they just send a text and it's a first come, first serve basis. Whoever accepts it, takes it. Okay. I have used that model in my business too, where I have a list of caregivers. And during interviews and during trainings, I always remind them, you are in the pool of caregivers. Whenever we have a client, we are going to shoot a message to which is going to go to everybody, and that is going to be a first come, first serve basis. That saves you a lot when they are PRN, okay? They're still W-2, but they're PRN, okay? It saves you a lot because when it comes to full-time, then that means that whether you give them a client or not, then that means you have to pay them the 40 hours per week, right? So what if you don't have a client and you have somebody here, you owe maybe $400 per week and you don't have that money, okay? Then once you start making money, then you can start shifting the caregivers. That is an incentive too. Okay, that is an incentive of shifting them. When you see there's a caregiver who is taking more than 20 hours per week, you can start shifting them to the model. Like I remember I started shifting mine like from the model of PRN. There was one caregiver I shifted to, actually two that I shifted to part-time. All right. So with part-time, of course, you have like additional, what do you call it? You have like additional like benefit for them to take part-time. That means when you're telling them part-time, you're telling them, I am guaranteeing you part-time hours, 20 hours a week or more every week. Okay. So you have to be sure you're guaranteeing them that. And, you know, whenever you have like part-time or full-time, you have to fill the part-time and full times before you can go to the pool. Okay. So those are just simple strategies. Start with PRN on call or on demand, however you want to call it. On demand, on call. I like on demand, but it's the same thing. On call, PRN, you know, whatever you want to call it. And then start shifting them now to part-time, and then you shift them to full-time. You don't shift them, all of them together. You shift them as you go. Okay. As you have the clients. All right. So, as needed hiring offers flexibility, but also it can have a lot of high turnovers, right? Because it's not guaranteed hours, right? And so you have to really keep in communication. I kept in, like for my pool, because I had a big PRN pool, I kept in communication with them. I still do keep in communication with those who have chosen to stay in the database, because after 6 months, we do database cleanup. And during the database cleanup, we give them an option to say they don't want to be in the database anymore or they want to continue. I think for the time that I have done this, I've not lost anybody. I think I've lost 2 people from the database, and one of them I lost her because she couldn't do this. She was on full-time nursing. The other one just had moved on to other things, right? So my database team, and to date, I still have them, but some people have moved to part-time, all right? So you always have to be strategic in your business and know what is going to work for you, okay? So the advantages of having PRN, the workforce flexibility that scales with client demand fluctuations, because it's not all the time that you will have the same number of clients. It will be up and down depending on what is going on in the season. It will be up and down, especially during the holiday time. Lower fixed labor cost, of course, because you're only paying for the hours that have been worked, right? You're not paying for benefits, right? And then it's simpler scheduling for part-time workers or PRN. It's simpler. It's actually simpler scheduling. And, you know, if you are in my community, you get to learn all this, right? So, and then you have the ability to match specific caregiver skills to particular client needs. Now, I remember I told you that sometimes I would pull someone, if like you can pull someone if you see they have something that a particular client wants. Like if you have a caregiver that has dealt with dementia clients, you know, that's an option. If you've dealt with, you know, a caregiver that has taken care of cancer patients or diabetic patients, you know, you can check with them first and then move on to other caregivers. So the challenges that you'd face here are significantly higher turnover risk and reduced caregiver loyalty. Of course, because they're PRN. If they get full-time somewhere else, then they will take it. So what you do, you get creative on keeping them engaged. They can still take other jobs. So what I did with my caregivers, I always did in-services for them. I always did check-ins, but I always let them know that they can take other jobs, if they want to, because of course they're PRN, you cannot keep someone there waiting for you, right? So I would let them know that, I'm still thinking about them. When I get clients, I'll be able to schedule them. But normally, because they're PRN, when you get a client, you just shoot a message, whoever is available or whoever can adjust their schedule, they will do it. And most caregivers, they work in maybe nursing homes or assisted living homes or in the hospital. So most of the time they have like 3-day shifts, so they would be able to do your care during another time. So it has worked, okay? Scheduling can be unpredictable and last minute changes. That is going to be an everyday thing. If you are in healthcare, scheduling is one thing that changes every minute. In the morning, you could wake up and the schedule is good. And then by the time it's 10 o'clock, the schedule is changing because either the patient was not at home, or either the caregiver did not make it, or either the caregiver's car broke down, or, there's always something going on. So the scheduling has to be on top. The scheduler has to be on top of everything, okay? The scheduler position is one of the positions that is very critical also in the administrative side. So when it comes to the care of patients, the caregivers. But when it comes to the administrative side, the scheduler has to be on top of it. The scheduler has to be on top of it. And if you'd like me to help you with training your schedulers or training your team, your admin team, just let me know. Just, set up a meeting with me and I'll be able to help you with that. Because before I started my agency, before I ever got into any of this home care, or before I went to school and did other things in healthcare space, I used to be in the intake and scheduling team. So I'm very, very conversant with scheduling. And I used to schedule for an organization that has more than 5,000 employees. Okay, of course, I wasn't dealing with 5,000 employees, but I was dealing with the Texas region and I was dealing with the North Texas region. Okay, sorry about that. Just some noise. So if you had some noise, I think someone was trying to get their motorbike out of the way. All right. So weaker caregiver client relationships affecting care. Now, I always try my best. To keep the same caregiver with the same client for as long as that client is going to be with us. Okay. Shifting caregivers back and forth can also affect. So you always have to let the caregiver know that the schedule that they have given you, it's working. It's going to be a workable schedule. And if they need to make any changes, the client has to be involved so that we don't have to take another caregiver to them. So limited investment in training and professional development also, because sometimes because they're PRN, you might think that they don't need to do that. But the challenge is getting them in to do it, okay? So there are different ways you can do it. You can have one day that is a field day. So they come somewhere and you finish all the in-services together, And so there are very many ways you can tackle that, but it's also one of the limiting things that can happen while you're working with caregivers. Full-time pools advantages: enhanced staff stability and stronger client relationship, consistent training, implementation, and quality control, higher team morale with predictable schedules and income, and then lower recruitment costs due to reduced turnover. So you're not always hiring. So the challenge is higher fixed operational costs. So guaranteed hours and overtime. Remember, overtime is not guaranteed. Overtime is not guaranteed. Like for my agency, there's no overtime, for example. There's no overtime. If you go over your time with a client, we have, and they know that, the caregivers. So the next day they will have to come in late, and the clients also know there's no overtime. So there's no overtime. If you want to pay overtime, be very clear that you will pay overtime, time and a half. Okay. And then higher fixed operational costs when it comes to guaranteed hours. Remember, I said when you have full time, you have to pay them 40 hours. You have to pay them the full-time hours, okay? Risk of underutilization during low demand periods. So that's the same thing as the first point. If you don't have clients, it doesn't matter. You still have to pay them. More complex administrative requirements and higher expectations for benefits and advancement. That's why I said there's an expense in full-time. When you have full-time caregivers, you also have to think about benefits. They need to have benefits. And remember, the employer has to pay some and they have to pay some too. So you have to let your business grow at its own pace. That's what I'm coming to. Let your business grow at its own pace. If you can start with PRN on demand, on call, and then keep growing and taking them to part-time or full-time, that makes a difference, okay? So you have to be creative in the way you do retention, okay? So over 54% of caregivers rely on public assistance, making traditional benefit packages a challenge for many agencies. So be creative in how you give those packages, like flexibility, empowering staff through scheduling, autonomy, and work-life balance. Development, investing in growth through certifications and clear pathways. Actually, that reminds me, there's one caregiver, before he left, he went to be a PA. He went to PA school, but while he worked with us for a very long time and wanted to do CNA. And because of his tenure and his consistency, that guy never called in. Oh my God. He never called in. And this family really loved him. So he went and did his CNA, and the agency was able to invest in him. So he went and did the CNA and stayed with us for about, I think 6-7 months later, and then he was admitted for his PA school. So that was good that he was admitted. We missed him, but it was good that he was admitted to a better, a higher school level, and so we couldn't hold him back. So those are some of the things you can decide to be creative and tell them, you can pay them by 10, like you can give them, like, pay for them a course or something to do at the agency's cost. But that is for those, not for just for any caregiver. That is for those caregivers who they really, really are doing their job and they really, really love what they're doing. Then recognition, building loyalty through consistent appreciation and financial support. Especially during holidays, it's very nice to support your caregivers. During holidays, like if you're having the Christmas time, you don't just give them a gift card, just give them a nice package, so that they can feel that they are really wanted. During Thanksgiving too, you can decide to do something for them. During their birthdays, you can decide to do something for them. Then recognize them for their tenure with the company. Recognize them when the clients call and they say, "Oh my God, we cannot do without Magdalene." Okay, Magdalene. We cannot do without Magdalene, okay? So think about that. Think about those things, all right? So you empower your caregivers through scheduling and growth, scheduling flexibility and career development, self-scheduling options. If you are comfortable, you can do that, all right? Self-schedule the options, and then float pools. Float pools are what I was telling you. I have a pool. I have, they choose their shift, or I drop the shift that's available there. So compressed work weeks. If you have full-time caregivers, you can always do this compressed work shift where they work 4 days a week, and then they take a break, okay? Or you can do development, certification, reimbursement, and mentorship programs for professional growth. So, just the way you can do tuition reimbursement kind of thing, they do a certification, and if they complete and they pass and they bring proof that they have done the certification, You can decide that's a benefit, and you can, reimburse them depending on your reimbursement policy. You also have to make sure you have a reimbursement policy where someone is not going to use 20,000 and then your reimbursement policy is 2,000. Okay, so you also have to have a reimbursement policy. They know that if I go and do this course and it's $1,000, I'm going to be reimbursed by my boss. Okay, so clear advancement pathways. Show how short-term potential with the agency. That's why I was showing you, like, if you start like from PRN, you can show them the potential of how they can move to full time, or you can show them the potential of how they can shadow in the office and become an admin. Magdalene, for example, was a CNA, a PRN, then she went part-time, but then she started doing some administrative work. Okay, that's my Magdalene. Yeah, so now she will see some clients, but then her work is mostly administrative. Okay, but she will see some clients. Like if you have caregivers calling in and they cannot go, she sometimes will take that, and those are two different paychecks. Okay, and that we will talk about. So if you're in my community, you know how to do that, because you cannot pay them the same thing as, it doesn't make sense. So they have their office rate and then they have their caregivers rate. So even 500 annually toward continuing education is significantly boost retention while enhancing care quality. Okay. Yeah, so small investments, your recognition systems, you can do caregiver of the month awards, like you do like cash, like it's a bonus cash, all right? You can do client nominated recognition programs. I just mentioned that. And then milestone celebration, work anniversaries with gifts, right? I just said that. You can also do birthdays too with gifts, right? And then financial alternatives, gas cards, or transportation stipends, and then partnership discounts like gyms and restaurants, and then emergency assistance funds for unexpected hardships. You have to write those on a policy. Okay, all these things, you have to write them on a policy so that you don't have utilization problem. Okay, all right, so you have to have a policy for all these things, not just saying it. Especially if you're growing very fast, have a policy so that the people who you keep in charge, they know, okay, there's emergency assistance fund. What is the fund? What is the maximum? What do we do? All that. Yeah. So personalized incentives based on regular feedback provide the greatest return on investment. So you strengthen your connections through communications and tools, communication and community, weekly check-ins, quarterly team buildings. And then if you have PRN, quarterly team buildings might be a challenge, right? So you have to like really plan it way in advance, like maybe every 6 months, because they are PRN. Okay, so you can't, you can't really control their time like a full-time person or part-time. But PRN, you can always schedule like a 6 months. Then peer support, then technical mobile-friendly apps. Mobile-friendly apps is very, very important so that it makes it easy for them to log in their shift, to log in their care notes, to clock out, to also inform the office if there's something going on that they need to fix. Okay, then digital recognition platforms, peer appreciation, and public shoutouts. Streamline documentation, okay, systems to reduce administrative burden and paperwork. Okay, so now data-driven retention is key to your business success. So choose the hiring model that fits your specific stage. Remember, I just told you to start from somewhere. Start slowly. Move from PRN, on-call or demand, however you want to call them, to part-time to full-time. Okay? Personalize retention based on your regular caregiver feedback. And then use surveys and exit interviews to identify high ROI incentives. Okay? Then then you tell them, they can subscribe for more. And I always tell you to subscribe for more caregiver business strategies. And I always will tell you to subscribe to my channel. If you feel today was a day that you learned a lot, let me know. Let me know your feedback. If you are stuck and you have a question, you can drop it in the comments. I am going to respond in the comments. Or if you want to schedule a 30-minute discovery call with me, you can do that. And then during the discovery call, we can know how we are going to move ahead and how I'm going to help you and your business. If you are stuck in the idea phase of launching, now this is the part for you. If you are stuck in the idea phase of launching, the Homecare Launchpad is going to be launching on the 1st of May 2026 at 7:30 p.m. Central Time. So this is for you. It's for you if you are stuck with startup process, ready to work without second guessing yourself, ready to work at your own pace or with me directly, and tired of expensive consulting fees, but the same results. So this is the deal. If you would like to be in the live, it's going to be a live Founders Lounge. The Founders Lounge is going to be on the 1st of May. I want you to drop me a message. Drop me on the comments. Say launch. Okay? Just say the word launch in the comments and I will send you the link. Okay? I will send you the link. There's limited spots, of course, because we know we can't have so many people, but you are in the idea phase and you want to launch your home care. I put my heart in this app. Okay. Everything that I would do for you on a one-on-one, I have put it in the app. You can log into the app and then you start working through your process. Now, the app right now is supporting Texas, okay? There are other states that are going to be launching every month, but right now it's supporting Texas. But even if you're not in Texas, I still support you as a consultant and you can always work with me. But on the 1st of May, if you can come and join me and just, learn through with me, that will be fantastic. So I look forward to meeting you. Today, it's been a very long learning day, but I would rather come and talk about things and not just brush off quickly so that I can get off. I would rather come here and share quality and quantity. And I know some of you've had things to think about. If you are thinking about how you can retain your caregivers better, let me know. Send me a message. I'm always open to communicating with you. The people who have written to me and scheduled appointments have been, I've been able to talk to them. But if you schedule an appointment and you don't show up, you only have one more chance for a free, you only have that chance for the free one. The next time you try to come into my calendar, it will tell you to make a payment because it's recognizing you as a person who scheduled a meeting and did not show up. So if you schedule a meeting and you did not show up, please go ahead and try and schedule again and see if it will let you. But I will be dropping again. I'll be talking about the launch. So I'll be talking about it again soon. If you'd like to be in the launch, please let me know. Drop a comment and I'll be there. So I wish you a nice day. It's Friday and I hope you have a good weekend. All right. Until next time. Be blessed. Don't forget to subscribe if you're watching me for the first time. Subscribe to my channel and hit the button so that you can always be reminded that I'm online. Thank you.